which of the following factors is most likely to be associated with the patient's diagnosis? 60-year-old woman with history of rheumatoid arthritis, 2-week history of worsening headache and blurred vision. She's been taking methotrexate. Brain MRI reveals a solitary enhancing mass in the right occipital lobe. Stereotactic biopsies performed. Histopathological exam reveals diffuse infiltration of atypical lymphocytes. Immunohistochemistry is positive for CD20. All right, which of these following factors most likely to be associated with the patient's diagnosis? All right, let's see.
What's the patient's diagnosis? You got to start with that first.
All right, worsening headache, blurred vision, enhancing mass in the right occipital lobe. I mean, ring enhancing could be a few different things. It's like when I think of that, I think of like toxo. I think of it could be a lymphoma.
Okay, good. Okay. So look at the biopsy.
All right.
And
The
then,
biopsy CD20.
okay, so what is it? CD20.
CD20 like screams B cell to me, so it's like okay.
Okay. So what's your diagnosis? If you were to put, money on one diagnosis, what are you going with here? You kind of talked about it a little.
Atypical lymphocytes. I mean, could be immunosuppressive therapy, but I'm not.
Well, don't look at the answer choices. Okay, I want you to
Okay.
give me a diagnosis. Remember how we talked about this? I want you to give me a diagnosis.
It could be something like a B cell lymphoma.
Okay, good. So I want you
Then
to
metastasize to the brain.
okay. So I like that you said okay. So B cell lymphoma. Okay, so let's go with that, right?
Okay.
So now then pick an answer choice that matches that diagnosis.
Well, tobacco use doesn't make sense, right? Hereditary
Okay.
predisposition. I mean, maybe. HPV. I don't know if HPV has anything to do with like a B cell lymphoma. Immunosuppressive therapy means she is on methotrexate. I don't think this is I think with methotrexate, I think they like pulmonary fibrosis as a. No, wait, that's not right. There's a different side effect that they like with that. Ionizing radiation exposure. Maybe, but I don't know if that would. I don't think that makes too much sense here. Immunosuppressive. I mean, she is on immunosuppressive therapy, but I'm not super confident in how I'm answering this.
So what's your gut say?
I would just, yeah, immunosuppressive therapy, but it
Okay.
still doesn't feel that good.
Yeah, it's immunosuppressed there. So let's work through this, right? So
Okay.
you got a 60-year-old woman. She has rheumatoid arthritis. She's on, methotrexate, right, which is immunosuppressive drug, right? And lymphomas and leukemias, right? Remember, your body's immune system is responsible for killing cells that are abnormal, right? That have bad DNA, et cetera. So if you're on immunosuppressants, then these random mutated cells that become cancer, right, they can kind of proliferate now, right? And so one of the things that you got to worry about is immunosuppressive. And let's talk about this a little bit more here. What's one of the main risk factors of primary CNS lymphomas that we get tested on a lot on step one?
I think it's HIV, right?
Yeah, HIV, which is immunosuppressive, right?
Yes.
Yeah, so your body can't really protect itself anymore from these cells that divide and have bad DNA or mutations, right? And so
Okay.
kind of the same mechanism action, right? But hereditary predisposition, not really, right? We don't inherit primary CNS lymphomas, right?
I don't
HPV,
think so, yeah.
usually cervical or head and neck cancers with squamous cell carcinoma, and most of the
Yep.
time ionized radiations, right, increases risk factors of gliomas, meningiomas, but not really primary CNS lymphomas, and tobacco use, lung, head and neck, bladder cancer, but not really primary lymphomas. So good.